House of Wellness, powered by Himalaya Wellness Company. Welcome to House of Wellness, a podcast powered by Himalaya Wellness Company. Wellness is a holistic practice that we need to inculcate in our daily lifestyle. By making informed decisions and remaining consistent with our healthy practices, we can lead better lives. Hello to all our listeners and welcome to another episode of House of Wellness. We continue our conversation with Dr. Jayashree B. Keshav, an Ayurveda expert from Himalaya Wellness Company. Today we'll be discussing women's wellness and the secrets to fighting menopause symptoms. Welcome back, Dr. Jayashree. So to start things off, Doctor, every woman goes through this phase in life that we call menopause. Could you please help us understand what exactly menopause means?
Sure. Menopause marks the end of menstrual cycles in women. It is a point where a woman has had no menstrual periods for a year. Menopause usually occurs when a woman is in her 40s or 50s. Although it is a natural biological process, menopause can have a great impact on a woman's well-being.
From the 40s to the 50s is actually quite a wide range. Are there any common symptoms that can help women identify that they are close to or approaching menopause?
As they approach menopause, most women begin to experience a range of physical and psychological symptoms such as hot flashes, night sweats, weight gain, sleep difficulties, thinning of hair, pain in the joints, decreased sexual desire, irritability, anxiety, poor self-esteem, fatigue, mood swings, forgetfulness, and even depressive disorders. These symptoms can be very debilitating and they can disrupt the quality of life of these women.
Moving on, are there any potential health issues that could affect women going through menopause?
Menopause is characterized by hormonal changes. In the long run, the depletion of the estrogen and progesterone hormones could lead to osteoporosis, heart diseases, and urinary incontinence, or what we call as a loss of bladder control.
So at what point would you suggest that a woman going through menopause should consult a doctor?
Women who experience an early menopause or those who have undergone surgical menopause, which is before the age of 45, should consult a doctor, as they are bound to have a higher risk of osteoporosis, heart disease, and dementia compared to women who attain menopause naturally in their 50s.
I'm sure lifestyle changes have a huge role to play in this. Could you suggest a few lifestyle changes for addressing the symptoms of menopause?
Menopausal symptoms can be effectively managed by adopting healthy dietary practices and lifestyle modifications. Menopausal women should get adequate calcium, increase their iron intake, get enough fiber, drink plenty of water, and maintain a healthy weight. If they are overweight, they should try to lose weight by cutting down on portion size and not by skipping meals. They should also reduce foods which are high in fat, use salt in moderation, avoid smoking and alcohol consumption, and be physically active. Regular physical exercise can be especially beneficial in preventing osteoporosis, which is a common risk factor in menopausal women. Exercise helps improve strength, agility, balance, and posture, and therefore reduces falls. Older women are at an increased risk of falls, which results in fractures. Certain measures such as reducing home hazards, correcting hearing and vision defects, and addressing neurologic deficits must be looked at to help avoid falls. It is also important for postmenopausal women to ensure that they have adequate calcium and vitamin D levels.
So, doctor, is there any way in which the lack of hormones during menopause can be compensated?
Yes, the estrogen hormone plays an important role in the growth and functioning of the female reproductive system. Estrogen deficiency during menopause increases the risk of many health problems. Herbal supplements which are rich in natural estrogens, or what we call as phytoestrogens, help compensate the hormonal loss during menopause.
Just to clarify, what exactly are phytoestrogens?
Phytoestrogens are plant-derived compounds that structurally or functionally mimic mammalian estrogens. Therefore, they are considered to play an important role in the prevention of menopausal symptoms. Phytoestrogens are present in many foodstuffs, including fruits and vegetables, and they are known to curb menopausal symptoms.
And lastly, what suggestions does Ayurveda have for menopausal health?
One can always find answers to questions about physical and mental health in the contemporary life science Ayurveda. In fact, the basic tenet of Ayurveda, the science of life, is wellness. Herbs play an important role in reducing the menopausal symptoms and are considered safe. Herbs are rich in phytoestrogens that have estrogen-like effects, and they help reduce the menopausal symptoms. Furthermore, the risk of heart diseases, cancer, and osteoporosis are also reduced. Various herbs such as Mandukaparni, Haritaki, Yashtimadhu or Licorice, and Ashoka can be of immense benefit in the management of menopausal symptoms. Yoga, with its restorative power and calming effect on the mind, can also be of help in managing menopausal symptoms, including menopause-associated stress and anxiety.
Thank you so much, Dr. Jayashree, for a very insightful session. I'm sure this discussion and the information you provided will help a lot of women. We hope this session has helped our listeners and motivates them to take charge of their life. Reach out to us if you have any questions. Visit www.himalayawellness.in and drop your queries in the Ask Your Expert section with the hashtag House of Wellness. Details are given in the description of the podcast. See you all in the next episode of House of Wellness, a podcast powered by Himalaya Wellness Company. House of Wellness, powered by Himalaya Wellness Company.